We're speaking to Alex Berenson, author of Pandemia, best-selling book. Get your copy today, $2.99 on Kindle. Alex, the vaccine makers have already talked about the possibility of an Omicron. Now, they're not saying they're doing it, the possibility of an Omicron-specific variant. There is also talk about a fourth shot. I believe the fourth shot is approved in Israel. Correct me if that's wrong, for people who are considered at high risk. But, of course, the risk parameters keep changing over time as the vaccines wane in efficacy. Have we just completely abandoned the notion? There was a time when we believed it was get the shot, you're done. Does anyone think there's even on the horizon a get the shot for COVID, you won't get infected, you don't have to worry about it, or has that just been completely abandoned?
I mean, that's a great question, and I don't know what they're. Let's say in a perfect world they could invent that shot. Okay, they could invent what's called a pan coronavirus vaccine that would work for all the variants and would work long term. I'm not sure they could sell it to anybody. Okay, because the last year has been such, a cluster, and their promises have been so unmet that, I'm not going anywhere near that for years and years. And I would suspect that lots of people, now listen, I didn't get the vaccine to begin with, but I think there are a lot of people who did get the vaccine who feel pretty cheated right now. And, I wrote this on my Substack on Monday. We're talking medically right now, right? We're sort of talking about some scientific questions, but I do think politically and culturally, much of the United States is past COVID and just wants people to stop talking about this. That, until the day that the hospitals actually collapse, the public health authorities have cried wolf one too many times or 10 too many times. And they don't want to hear about it. If they didn't get vaccinated, they're not getting vaccinated. If they did get vaccinated, they feel they did their bit for the team, and they don't understand why they should do this again a couple months later. And when people like Fauci or, other public health, grandees say, oh, we always thought we'd need a third shot, a fourth shot. People know that's not true. I mean, we were all alive 6 months ago. We can all remember 6 months ago.
We're talking to Alex Berenson. Encourage you to go grab his book, Pandemia. Alex, last year in mid-January, the number of COVID cases in the United States peaked. I believe it's still the all-time high. Today, England hit a new high for all-time cases. Yeah. What do you think? And I know, again, predictions are sometimes difficult, and I understand that that's a challenge. But based on the data that you are seeing from Europe and around the world, what do you think the next month looks like? Do you believe that we are going to approach new highs in the number of cases here in January like we did last year?
I think it's quite possible. I mean, and it's not just the UK. Germany is off the charts. The Netherlands off the charts. I think cases don't really matter that much, right? Especially if it's Omicron, and Omicron is less, virulent as it seems to be. And I would sort of discourage people from panicking if the case numbers do go up. What matters, is hospitalizations and is deaths. And I will say that, whether it's because, the UK has boosted a lot of older people. So when you boost, you get this temporary benefit where people's antibodies do go up and they are less likely to suffer severe disease and death in the short term. The problem is, you don't know what that looks like long term. But if you're dealing with the vulnerable people over 65 and especially over 75, giving them the booster in the short term reduces death counts and maybe reduces the strain on the hospital system. So that's a good thing. And that is what, we've done that in the U.S. And they've done it in Europe. So the case counts are off the charts, but hospitalizations and deaths are not over there. And I would hope that would be a similar case here through the winter.
Do we know, Alex, if Omicron natural immunity would be protective? Again, is there any data? Do we have any idea? I mean, I really have two natural immunity questions for you. One is, if you get one variant, are you likely protected against the others? I know nothing is perfect. Even natural immunity is not perfect. But do we have any numbers on that? And also, at what point do we see that this disease feels like it will have gotten infected a solid majority, perhaps, getting upwards of 60, 70% of the American people? I mean, this has been going on for 2 years.
So that's both great questions. The short answer is right now, I haven't seen any studies about whether Omicron translates into other protection. But here's how it works, right? The new variant chases out the old ones. So Delta came along, and Delta was basically 100% of the COVID out there. So it didn't really matter whether Delta was protective against older variants. It mattered whether older variants were protective against Delta. And that'll be the question with Omicron is, will Omicron be protective against the stuff that comes next? And that becomes even more complicated now because we're in a situation where many, many people have been vaccinated. And there's some evidence, unfortunately, and it's weak right now, and I don't want to overstate it, but there's some evidence that vaccination may interfere with protective natural immunity after infection. So in other words, you get vaccinated, you get infected, your immunity is not as good as it would be had you been unvaccinated, infected, and recovered. And I don't want to say that with any certainty. When I say the evidence is weak, I mean it's weak, but it's there.